In this video, we're testing our diagnostic skills. Here's how it'll work. I'll present a fictional case and give a variety of details about it. Then you'll take some time to figure out what diagnosis you think is appropriate. At the end, I'll provide you with the diagnosis, and we'll review the diagnostic criteria, discussing why this client does or does not meet each. So bust out your DSM, let's review the Case of Eleanor. But first, my name is Keegan. I have a master's degree in counseling and I'm a licensed professional counselor. I make videos like this to help you better understand counseling, psychology, and the world of mental health. This is the fictional case of Miss Eleanor Vance. She is a 38-year-old woman and somebody that you have been seeing in therapy for around a year. She originally presented to therapy expressing significant distress related to a recent breakup. As you worked with Eleanor, you learned that she has a history of unstable relationships. She has discussed with you how she's aware she quickly moves from one relationship to another. Eleanor explains that when she's not in a relationship, she feels empty. And she discusses how when she's not in a relationship, she can feel a sense of desperation about finding her next partner, and that it feels impossible to her to ignore this feeling. In fact, she'll often describe it as all-consuming. Throughout your sessions with Eleanor, when you encourage her to share more about herself, she tends to focus more on how others might be looking down on her. You notice that when you highlight her accomplishments or strengths, that she is quick to minimize these. Almost always, she will explain that what people think are her accomplishments or strengths of hers are really just because she had somebody else there to help her. In a recent session, Eleanor said that she isn't very good at things on her own and that it's very difficult for her to work without the help of others. A pattern that you've noticed throughout your sessions with her is that she will go to great lengths to avoid disapproval. When you point out this pattern, Eleanor says she has always been this way. She describes how she has a need for reassurance and how she habitually seeks the approval of others. Another pattern in Eleanor's life is frequent job changes. Adding to this, she struggles to find work that is satisfying for her. Eleanor has a strong desire to work in a position that is closely supervised and that does not require her to work on her own. She shares that if a supervisor or coworker tells her what to do and how to do it, that is ideal for her. In past jobs, it's been consistently noted to Eleanor that when she works independently, her work performance does not meet expectations as her productivity is consistently below what would be expected. Eleanor recognizes this and says that it's extremely difficult for her to work alone and that she often feels very overwhelmed in these situations. She says that her feelings of anxiety when she's working by herself are what causes her to struggle with completing her work in a timely fashion, and says that she feels as though she's always second-guessing herself. Eleanor also says that she avoids starting projects on her own as she doesn't feel as though she knows what she's doing. She notes worries that others will question why she's starting this project or that they'll question her work on the project. Outside of work, Eleanor also struggles with decision-making. In fact, she says that she's afraid that she may be incapable of making decisions. From what she describes, she easily goes along with what others say. And she often notes how it's best when others will make a decision for her. As you've worked with her, you've asked for her to share times where she's disagreed with somebody. Eleanor says that it's almost impossible for her to ever actually say that she disagrees. Even when she feels strongly about something, she will almost never actually say that she disagrees, as she's afraid others will abandon her for expressing her opinion. Early in her treatment, Eleanor confided that she struggles with even making seemingly minor decisions, such as what to eat or wear on a daily basis. Her partner was the one who typically made these decisions, as they noticed how difficult it was for Eleanor to try to make these decisions. This was the partner from the relationship that ended that brought Eleanor into treatment. They had been in a relationship for around 2 years, and Eleanor found a great amount of relief in having somebody to help with making decisions. Now that the relationship has ended, Eleanor describes feeling unable to function because of the anxiety she feels about being alone. She's often exasperated and says that she's overwhelmed by feelings of being completely lost without her partner, especially when trying to make decisions. In your sessions with Eleanor, she often seems fixated on the idea that she needs a partner to take care of her. And it seems as though every session she discusses her anxiety about being on her own. Eleanor's presentation to sessions is almost always anxious. She's typically tearful and avoids eye contact. Her tone of voice is often soft. Eleanor's affect tends to be constricted, and her mood is consistently dysphoric. You notice that she tends to seek reassurance from you. When you do provide reassurance or validation, she often verbalizes her appreciation for this, although it does not seem as though it actually ever satisfies her need for reassurance or validation. The content of her thoughts, though, are almost always overwhelmingly related to her belief of being inadequate and her fears of being abandoned. Eleanor denies suicidal or homicidal ideation. Now, feel free to pause the video and take some time to consider what you've heard about Eleanor's case. You can go back and listen to sections again if needed. Once you have your answer, put it in the comments and come back to this spot so we can review the diagnosis. Welcome back. We're going to discuss the diagnosis for Eleanor's case in just a moment. Before we do that though, if you're enjoying this video and finding it helpful, please help me out by giving it a like and subscribing. Here's the diagnosis. Based on what is reported, a diagnosis of dependent personality disorder would be the most fitting for Eleanor. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, text revision, or the DSM-5 TR, says that dependent personality disorder is a pervasive and excessive need to be taken care of that leads to submissive and clinging behavior and fears of separation. There are 8 criteria for dependent personality disorder, and 5 are needed to make the diagnosis. Let's quickly review these to see which Eleanor would meet. First, the person needs to have difficulty with making everyday decisions. And in the decision-making process, they'll excessively seek advice or reassurance to help them with making the decision. Eleanor appears to meet this criteria, especially when it comes to things like having difficulty deciding what to wear or what to eat on a daily basis. Second, they tend to need somebody else to take responsibility for major areas of life. For Eleanor, it seems as though this is the case, especially when it comes to her difficulty with making decisions or taking responsibility in the workplace and having to rely on supervisors or coworkers to help her make decisions. Third, they tend to struggle with disagreement as they fear they will lose the support or approval of others. Eleanor seems to meet this criteria, especially with how passive she can be, even in situations where she strongly disagrees. Fourth, because of lack of self-confidence or feelings of being incapable, they'll struggle to start things such as projects on their own. With Eleanor, we hear that this is the case for her, especially in the workplace. Fifth, they will go to great lengths to get nurturance and support from others. In some cases, they may even volunteer to do things that are unpleasant in hopes of getting this support or nurturance. Eleanor does not seem to meet this criteria. With more information, we may find that she actually does meet this criteria, but based on the information that we've gotten, I don't think that she meets this criteria. That said, you may be thinking that she goes to great lengths in relationships to keep a partner or to find her next partner when one relationship ends. And that is true, but we'll actually be getting to a criteria that better fits that than number 5 here. Criteria 6 is that the person will feel uncomfortable, even helpless, when they're alone. And it may be that they struggle with exaggerated fears that they are incapable when they're in these situations. And often they'll struggle with feelings of being unable to care for themselves when they're in these situations. Again, this is a criteria that Eleanor does seem to meet, as she struggles with feelings of being incapable of caring for herself when she's not in a relationship. 7th, when a close relationship ends, the person will urgently seek another relationship for the care and support of that person. From what she has told us, Eleanor definitely seems to meet this criteria. As I mentioned earlier in criteria 5, this is the criteria that I think better explains what we're seeing from Eleanor when it comes to relationships. If we saw this pattern of going to great lengths for nurturance, care, and support from other people outside of the relationship area, then I think Eleanor would meet criteria 5 as well as the 7th criteria. Finally, criteria 8 is that the person has unrealistic fears that preoccupy their mind related to being abandoned or having to take care of themselves. Again, this is a criteria Eleanor seems to meet, as she definitely seems to be preoccupied by these. Of the 8 criteria, Eleanor seems to meet 7, which is more than the 5 that are needed for a diagnosis of dependent personality disorder. Since these symptoms seem to be happening for most or all of her adult life, this supports this diagnosis. Let me know in the comments, what were some of the other diagnoses you were considering? This is the end of the fictional Case of Eleanor. This case presentation was for entertainment and educational purposes only. Any resemblance from this case related to a real person are purely coincidental. I hope that you found this video helpful. Make sure that while you're here, you check out some of the other videos on my channel. Thank you so much for watching, and I'll see you in the next video.